You must consult the user manual for the full contraindication list before treatment. This video does not replace training led by an authorized specialist. Always read the user manual before using the Emsculpt Neo device. Room and patient preparation. Position the device near the treatment bed as demonstrated. Do not place the device in direct sunlight or near heat sources, as it may lead to an excessive temperature increase for the device. Also, do not cover the device or the applicators during the treatment. Ask the patient to remove all jewelry and any metallic accessories, including piercing, before treatment. The patient should also avoid wearing any clothing with metallic parts such as zippers, bra wires, etc. Do not place any metallic item, as well as any electronic devices, cell phones, data carriers, credit cards, etc., close to the applicator. Consult the user manual for complete information about treatment precautions. Attach the belt to the applicator. Applicator placement. Biceps. For treating biceps, ask the patient to lay down flat on the abdomen. Put the applicators under the biceps. Secure the applicators with the help of the fixation belts. Make sure that the applicators are adequately secured to avoid any applicator movements during the treatment. Instruct the patient to press the therapy discomfort button in case of an emergency. This application can also be performed in a sitting position. Applicator placement. Triceps. For treating triceps, ask the patient to lay down flat on their back. Put the applicators under the triceps. Secure the applicators with the help of the fixation belts. You may bolster the limbs by towel to increase patient comfort during the therapy. Make sure that the applicators are adequately secured to avoid any applicator movements during the treatment. This application can also be performed in a sitting position. Applicator placement. Calves. For treating calves, ask the patient to lay down flat on their back. Put the applicators under the calves. Secure the applicators with the help of the fixation belts. Make sure that the applicators are adequately secured to avoid any applicator movements during the treatment. Start treatment. Choose the appropriate body part on the screen and confirm it by a play button. Select the desired protocol and applicator channel. Set the radio frequency intensity to 100%. Increase the HIFM intensity until reaching visible contractions. Correct the applicator's position to find the best muscle response. The patient should feel contractions homogeneously across the treated area. To ensure therapy efficacy, increase the intensity up to the patient's tolerance level. Emsculpt Neo treatments may feel very intense, but should never be painful. strong muscle response along with intense yet tolerable heating sensation is essential to maximizing treatment results. However, patient comfort should never be compromised. Make sure that you maintain the treatment settings just below the patient's maximum tolerance threshold. It is important to maintain verbal contact with the patient during the treatment. Ask them how they feel, adjusting intensity and position accordingly. The patient should feel intense but tolerable contractions without any pain. The treatment may require multiple applicator adjustments. To maximize the efficacy, it is essential to make adjustments during the treatment if necessary. If tolerated well by the patient, continue to increase the high firm intensity during treatment. Lower the RF intensity temporarily if the patient reports discomfort due to the heat. Lower the high firm intensity temporarily if the patient reports discomfort due to muscle contractions. There should be no pain during the treatment. Try to increase the intensity back to the original levels if the patient can later tolerate higher intensities. The warning symbol will appear on the screen if the applicator loses contact with the patient's skin. It is necessary to reposition the applicator to have the full contact with the patient's skin. Remove the applicator when therapy is completed. The patient may feel mild muscle fatigue after the treatment. There may also be a temporary skin redness in the treated area. Common mistakes to avoid. Do not start the treatment when the applicators are still in the holders. The applicator is not secured by the fixation belt. The fixation belt is not tight enough. The applicator is not in the full contact with the patient. The applicator must never be covered. This may compromise the cooling process. Patients must remove any clothing from the treated area.